name is Kristen Quinn, and I am a surgery resident at the Medical University of South Carolina, and I'm the co-founder and CEO of Heartbeat Technologies, LLC. I went to Vanderbilt University for my science undergraduate degree, went to medical school at The Ohio State University, and that's where I kind of got my first exposure to innovation. Me and some of my classmates in our second year of med school competed in the Johns Hopkins business plan competition, and just thought it was really fun and a very inventive way to use the physiology that we were learning about to kind of come up with ideas to improve patient care. And one thing that stood out to us was the very poor outcomes after a patient experiences cardiac arrest, and how CPR, despite being the standard of care, usually doesn't work. And 90% of the people who get CPR still die from their cardiac arrest. So that really stuck with us. And being in the clinical setting and working with these patients every day, I thought that we could come up with a solution to help them better. We were like, okay, we have this idea. We know how it could affect our patients, but there's this huge black box of like, how do we get from here to there? And also, how do we do it efficiently? We are busy people. A lot of people, I didn't want to give up taking care of my patients. And so I wanted to do something that could accelerate our business growth and help us kind of get this onto patients as soon as possible. And so we started looking for accelerators and really experts in, to be an entrepreneur, you need to be an expert at so many things. It's really intimidating. Just because I can describe what my product's going to do and how it's going to help patients doesn't mean people will want to buy it. There really has to be a very solid understanding of the value proposition, the market, my business plan, how I'm going to bring it to market, what my exit strategy is going to be. There are all kinds of words and phrases that I had not even really heard before. And being part of XLerateHealth really pushed us to have deeper conversations about those things and really hammer out our strategy. But I think what I liked about XLerateHealth was they really pushed us. Like, it wasn't always congratulating us on this idea. It was much more about, okay, now what, and explain yourself. And it was really I felt like a deeper dive and a more challenging, I felt like I was in a Shark Tank all the time, which was really good. Because someone's going to ask you those questions, and you'd rather it be people that are in your corner and can help you understand your answer and help you make a better answer if it's something that you're struggling with, than when you go out into the real world. Like, it just felt like a very safe, encouraging space, but they were going to ask you the tough questions, and that's to make you more prepared.